And then in the area of neurotrauma, Dr. Justin Moore from the Alfred Hospital in Melbourne.
Your Excellency, ladies and gentlemen, thanks for giving me this opportunity to speak. First things first, I'd just like to thank the Brain Foundation for the generous gift. It's going to make a difference to our research. It's very important for these sort of startup projects, so thanks very much for that. So what is my research involved in that of our group? Well, we're a trauma hospital, we're a level 1 trauma centre. You see approximately between 1 and 3 people per 1,000 present to a hospital every year with head trauma. The most severe of them will come in comas, and up to 40% of those patients will die, and up to 60% of them will have severe morbidity following the head trauma. So it's a major issue, particularly when you take into account that often these patients are young, often young men. So there's a lot of quality of life lost and good years lost. What can we do about it? Well, the accident happens. There's often not much we can do about it at the time. So all the focus is stopping secondary brain injury, which has a major impact and adds to the mortality and morbidity. When the brain gets injured, it does what every part of the body does, it swells up. Unfortunately for the brain, it's in a box, which is the skull, which can't expand to accommodate the brain. So what you find is the brain gets squished against the box and gets further damage, and this is often what causes the mortality in head trauma. How do we manage this? One of the ways we manage this is by putting a tube into the fluid sacs of the brain called the ventricles, and we divert the fluid from there, and then we can control the pressure in the brain and stop this lethal swelling of the brain and herniation of the brain. Now, it's a very good system. When we put it in, it works very well. The problem, though, is having a tube going from the middle of the brain to the outside exposes the internal contents of the skull to the pathogens in the environment. So it's very prone to infection, particularly as often these severe trauma patients have multiple injuries all over the place. They have infections everywhere. They have up to a 20% chance of having an infection there. And they get an infection in the brain, that often contributes further to mortality and morbidity. How can we reduce this? Well, what we're looking at is antibiotic impregnated catheters. So that tube we put in the brain, we can make them with antibiotics in there, and we can put the antibiotic impregnated catheters in the brain with the hope of reducing the risk of infection. Now, this has been preliminarily studied in general in neurosurgery because you can use these catheters for other things besides trauma, and the jury's out. There's a mixed bag of randomised control trials at the moment, so it's not clear if these antibiotic catheters will help. And in trauma, there's no study has specifically looked at their effect in trauma, and this is where they're probably going to make the biggest difference because there's a much higher infection rate in trauma patients. So our study proposes to look at these antibiotic impregnated catheters specifically in trauma and see whether this reduces the infection rate and also the outcome of the patients down the line, whether it improves outcome. So the ultimate outcome from this study will hopefully be improved patient care and improved utilisation, because these catheters are not cheap. So hopefully we can improve resource allocation with those as well.